Hi, I'm Doug Ichikawa.
And I'm Molly Ichikawa.
And we're both podiatrists in the Seattle area. And we wanted to make a short video highlighting the similarities and differences between the Lapiplasty bunionectomy and the Syndesmosis bunionectomy.
These are two procedures that are very similar in many ways, with some obvious differences. Both are great procedures for definitive bunion correction.
We have been popularizing the Syndesmosis bunionectomy over the last 8 years after having learned this procedure from Dr. Wu in Hong Kong, who has been doing this procedure for about 30 years. It is not a well-known procedure, mostly because there is no medical device company behind it, as with the Lapiplasty. It is interesting that the Lapiplasty has quite a social media campaign, so most bunion patients have already heard about it when they consult us about our procedure.
We'd like to start with the goals of any bunion surgery and highlight the ways that the Lapiplasty and the Syndesmosis bunionectomy achieve these goals.
We will then talk about the similarities and differences of both procedures. A quick note, the Lapiplasty is a type of Lapidus bunionectomy. This procedure uses proprietary jigs and fixation, but most of our comparisons today apply to all Lapidus type procedures.
The main goal of most bunion surgeries is to reduce the splaying of the first and second metatarsals that cause protrusion of the bone that we call the bunion. The splaying not only forms the bunion, but also the dislocation of the great toe joint where it angles back toward the lesser toes. A third thing the splaying does is increase the pressure on the second toe and metatarsal, and sometimes causes a hammer toe and pain here. The second goal of the bunionectomy is to realign the great toe joint. This involves tightening the joint capsule on one side of the joint and loosening the structures on the other side. The third goal is to reduce the prominent bump of the bunion. This is mostly reduced by the reduction in splaying, as we already mentioned, but it's usually helped with some shaving of the bony prominence as well.
The differences in most bunionectomies is how this reduction of the splaying of the metatarsals occurs. Almost all bunionectomies will accomplish this through bone cuts or joint fusion. The Lapiplasty or Lapidus corrects this splaying by fusing the joint at the base of the first metatarsal. The Lapiplasty in particular does this through a specific jig and plate configuration to help make this procedure more precise and reproducible, as well as aiding in the three-dimensional realignment of this metatarsal. The Syndesmosis bunionectomy reduces the deformity by releasing soft tissue structures on the inside of the big toe joint and naturally reducing the splaying of the metatarsals and holding them in place with strong suture. This is done for the short term, and a living biologic ligament called the syndesmosis is formed for the long term. This means that over the long term, after the syndesmosis has formed, the sutures are no longer needed and can be removed if desired. This will leave the foot with absolutely no hardware remaining. Most of the time, hardware removal is not necessary. Let's cover the three main similarities between the Lapiplasty and the Syndesmosis bunionectomy. That will be correction at the cora, mitigation of first-ray hypermobility, and history of copious study. The first similarity between the Lapiplasty and the Syndesmosis bunionectomy are that they both correct the splaying of the first and second metatarsals at the origin of the deformity, or the cora. This stands for the center of rotational angulation and means that the deformity correction returns the foot back to its anatomic natural state versus something like a MIS or an Austin bunionectomy, as you can see in the slide.
While the Austin bunionectomy does correct the deformity, and most patients are quite happy with this, the actual angle of the articulating surfaces of the great toe joint are not exactly as they were anatomically before there was any deformity. This could cause the eventual development of arthritic changes due to the subtle malalignment. That being said, most people that do have an Austin-type bunionectomy are usually quite happy with it.
The other similarity between the Syndesmosis bunionectomy and the Lapiplasty are that they both treat hypermobility. There is a condition with bunion deformities called a hypermobile first metatarsal, where the first metatarsal is extra flexible in its movement up and down and will allow for extra pressure under the second metatarsal or at the base of the second toe, causing pain and deformity. Both procedures can work to reduce this hypermobility. The Lapidus through fusion of the joint at the base of the first metatarsal, and the Syndesmosis Bunionectomy through the formation of a biologic ligament between the metatarsal shafts. Other bunionectomies are not as good at correcting this issue and can allow for continued pain or dysfunction at the second metatarsal. The third similarity between these two bunionectomies are that they are both well studied. Dr. Wu has written 17 evidence-based papers on the syndesmosis bunionectomies, and the Lapiplasty has had over 24 peer-reviewed publications.
We would like to spend the remainder of this video highlighting the differences between the syndesmosis bunionectomy and the Lapiplasty. Many of these differences are quite subtle, but are still relevant when deciding which procedure is right for you. The first difference is that the Lapiplasty relies on the fusion of a non-pathologic joint between the first metatarsal and the medial cuneiform. This means removing normal cartilage and encouraging bone growth across what used to be a joint between the bones. This requires the interface to be held stationary for several months while it's healing. This helps with stability of the foot and correction of the angular deformity. The syndesmosis bunionectomy does not fuse or manipulate this joint, and instead allows the metatarsal to realign naturally. The stability that affords the syndesmosis bunionectomy to maintain permanent correction comes from a fibrous growth between the first and second metatarsals.
The second difference between the two bunionectomies is the metatarsal shortening that comes with a Lapiplasty. The Lapiplasty and almost all other bunionectomies end up with a slightly shortened first metatarsal as the bone is cut or joint fused. This can sometimes lead to increased pressure and pain under the second metatarsal and behind the second toe.
The third difference is bone healing versus soft tissue healing. Almost all traditional bunionectomies, including the Lapiplasty, require the bone to heal just as with a fracture. The bone is either cut and shifted, or a joint is realigned after cartilage removal. The bone is then put end to end and held in place with a plate or screws. For the bone to heal successfully, the area must be free from any significant shifting over the next 6 to 12 weeks, and this is why you may be asked to stay off of your foot. With the syndesmosis bunionectomy, no bone healing is needed. The area is prepped for the formation of a pseudoligament or a fibrous connection between the bones. The soft tissue healing is less fussy and can have movement in the area without a loss of potential healing. That's why patients with the syndesmosis bunionectomy can walk right after their surgery, although steps are limited.
The fourth difference in the two procedures is the three-dimensional rotation of the first metatarsal that's possible with the Lapiplasty and not with the syndesmosis bunionectomy. This is to correct the abnormal rotation of the first metatarsal. The syndesmosis does not allow for any correction, as the ligaments and joint capsule of the first metatarsal cuneiform joint are not severed or manipulated in any way. We have found that the corrected position of the syndesmosis bunionectomy is not lacking in any way, even though three-dimensional correction has not been exacted on it. The whole idea of the need for metatarsal derotation is a bit esoteric and definitely open for debate.
The fifth difference between these two procedures is that the Lapiplasty involves a medical device company that profits from the use of this procedure, so there is a significant marketing and social media campaign to promote it. When Googling bunion surgeries, the Lapiplasty is almost sure to come up near the top. In contrast, the syndesmosis bunionectomy has only the small amount of posting that Dr. Wu and our clinic have put out, and not much more.
The last difference between the Lapiplasty and the syndesmosis bunionectomy is surgeon availability. The Treese Medical Company is quite good about directing patients to surgeons that are competent in the Lapiplasty procedure, and they have facilitated excellent training programs. In contrast, the syndesmosis bunionectomy procedure was popularized by Dr. Wu in Hong Kong, and even though he has been doing this for over 30 years, he has been unable to attract many surgeons to the procedure. As we have been doing this procedure over the last 8 years in the United States, we find the same situation. The reason for the lack of popularity of this procedure within the United States has to do with the traditional training of foot and ankle surgeons via the use of bone cuts and joint fusions. It is also true that the charges for this bunionectomy procedure are less, as one cannot bill for the bone work. We unfortunately live in a fee-for-service world. For this reason, surgeons practicing the syndesmosis bunionectomy procedure are quite scarce worldwide.
In conclusion, we hope that this video has helped highlight some of the similarities and the differences between the Lapiplasty or Lapidus and the syndesmosis bunionectomy procedures.
If you have any further questions regarding the syndesmosis bunionectomy, this information can be found on the website bellevuefoot.com, and my email address is on there. I'm happy to answer any questions you might have. Thank you.